Joe was a 60-something diabetic patient arriving at the emergency room swollen, very short of breath, and with fluid leaking from sores over his pitting, swollen legs. His swelling puffiness, or edema, worse than the legs, extended up all over his body, even around his eyes. When his kidneys were tested, we found elevated waste in the blood and protein in the urine, indicating the kidneys weren't effectively excreting waste products and yet were losing important proteins into the urine. We also learned his diet was terrible, his diabetes was out of control, his prostate had been troubling him for years, and his heart pump was weak after a heart attack 5 years earlier. He was one sick fella, problems piling upon problems, and so we admitted him into the hospital. Edema, that puffy, swollen, sock-denning problem formerly called dropsy, is very common to the human condition and can simply be due to poorly functioning veins and their tiny venous valves. Poor veins are treated by support hose and/or elevating the legs. Edema can also be due to a weak heart when the pump doesn't have enough push and pull to either push the blood through the kidneys or to pull the blood back to the heart from extremities and from lungs. Mostly, heart weakness is treated with diuretics and medicines. Sometimes in men, the prostate will block urine flow enough to slow down kidney function, causing edema. This can be fixed with catheters, prostate surgery, or prostate shrinking medicines. But the most challenging cause for edema happens when blood levels of that egg white-like protein get too low. This makes blood thin and watery so that fluid leaks out of blood vessels and into tissue. Low blood protein can be due to several problems: a diet lacking in essential protein building blocks, a liver that isn't making enough protein from those building blocks, or kidneys that no longer hold on to those proteins as they are filtered, resulting in protein lost into the urine. Low blood protein is difficult to treat. Indeed, Joe's problem with edema had several causes. We treated him by elevating and wrapping his legs, by medicines enhancing the heart pump and removing excess fluid, by a catheter opening up urine flow, and finally by improving nutrition and diabetic control. Long-term kidney problems won't go away for Joe, but for now, we could help. After a week in the hospital, Joe lost 20 pounds of water and went home without a catheter, breathing easy, leg sores healing.